The Youngevity UK and Europe Show with Dr. Wallach.
Hi, my name's Jonathan Smith. Welcome to the Youngevity UK and Europe Show with Dr. Wallach. Each week we'll go through the Dead Doctors Don't Lie show and handpick information regarding people's specific health concerns. So listen now as Dr. Wallach gives his expert advice on how to deal with the root cause of illness and disease nutritionally. If you would like further information on the products recommended in the show, they can be found in the description below the video. Enjoy the show.
The Youngevity UK and Europe Show.
I really want to talk a little bit about CD out called A Stick of Butter Day Keeps the Doctor Away. It's not an apple a day keeps the doctor away. It's a stick of butter day keeps the doctor away. And what it goes into are failed medical theories, including the second biggest one next to genetics is, of course, the failed theory is that cholesterol and saturated fat cause cardiovascular disease and clogged arteries and plaque in the arteries and all this kind of stuff, heart attacks, strokes. No. That was all a hoax. It was a sales program to sell Crisco by Procter & Gamble, okay? And, of course, a guy by the name of Ansel Keys, a medical doctor, actually on the board of Procter & Gamble and also on the board of the American Heart Association, brokered a deal by which Procter & Gamble gave the American Heart Association $1.7 million to endorse Crisco as a healthier way to eat. And, of course, the rest is history. We now have a huge problem because by getting everybody on a cholesterol-deficient diet and giving them statin drugs to lower cholesterol, we have Alzheimer's disease, ED, low T, menopause at age 30, and adrenal exhaustion. Oh, yeah, Alzheimer's disease. Actually, years ago it was zero, didn't have it even by another name. Today it's number 4 cause of death of Americans. Get a hold of a CD, A Stick of Butter Day Keeps the Doctor Away. Learn how to protect yourself and your family. Okay, Doug, what pearls of wisdom do you have for us?
Well, I thought we'd talk a bit about these over-the-counter and prescription heartburn medications, as I've got a CBS News story here headlined, Heartburn Drugs Linked to Recurring Superbug Infections. Say patients who take certain heartburn medications may be more likely to suffer recurrent bouts of superbug infections. These are the proton pump inhibitors such as Prilosec, Prevacid, and Nexium, or the H2 blockers such as Zantac, Pepcid, and Tagamet. And they are linked to a 50% increased risk of developing multiple Clostridium difficile infections. Study did not prove that the infections were actually caused by the drugs, but C. diff was an association there. They say C. diff can cause diarrhea and life-threatening inflammation of the colon. About 500,000 people get sick from C. diff every year. In recent years, the infections have become more common, more severe, and more difficult to treat. Gastric acid suppression medications are commonly prescribed and consumed over-the-counter for gastric reflux disease or GERD, peptic ulcer disease, or functional dyspepsia, and sometimes prescribed for unnecessary indications, which leads to overuse of these medications, according to the lead researcher here, Dr. Sahil Kahana, an assistant professor of medicine at the Mayo Clinic's Division of Gastroenterology and Hematology. And they go on to say recurrent C. diff infection is a major problem, with the risk as high as 50 to 60% of people having had at least 3 or more infections. Commonly affects older adults in hospitals or long-term care facilities. However, recent studies have shown an increased rate of infections in younger and healthier individuals without a history of antibiotic use or exposure to healthcare facilities. They have speculated that the suppression of stomach acid might affect the bacteria living in the gut, and these people leaving the door open for C. diff infection. Also possible that taking these acid suppressors may be that the people who are taking them are not as in a good health. This was all published in the Journal of the JAMA's Internal Medicine. They looked at 16 studies and more than 7,700 patients with C. diff, and among these, about 20% developed recurrent infections. Researchers found that 22% of patients taking acid suppressors experienced recurrent C. diff infections, compared to 17% not taking the drugs. So there you go, yet another reason not to take those, and not one mention of taking something like Ultimate Enzymes or nightly essence to help keep
peppermint oil,
or even peppermint oil. Yeah.
So we deserve a flourish there. Because I've been talking for 30 years about there is no such thing as acid reflux. It really should be called lack of acid reflux. You need to salt your food, which is salt is the raw material to make stomach acid. You can't absorb B12 because the intrinsic factor won't work to absorb B12 if you don't have stomach acid. You can't digest proteins into amino acids because the pepsin won't work in a neutral environment. Oh, yeah. And, of course, you need ants in your stomach to keep it sterile. So C. diff and E. coli and other bacteria and yeast won't grow in there. You won't have reflux and GERD of any kind.
The Youngevity UK and Europe Show with Dr. Wallach.
Thanks for listening to this week's show. If you're listening on YouTube, subscribe to the channel. And for more info on the products mentioned in this week's show, check out the links in the description.